Hi everyone, welcome. Today in Emergency Chaos, we will be discussing safety tips for new grad nurses going into the ER. Let's get started. So, why is this important? First and foremost, patient safety is the number one reason. Bottom line, you do not want to be the reason why someone got hurt. You've heard the saying, do no harm, treat your patients with compassion, you with family, but don't get taken advantage of, okay? And secondly, following appropriate safety measures allows you to protect your nursing license. People will sue despite you doing everything correctly, so get a nursing lawsuit insurance. You do not want to lose everything you've worked so hard to get. But most importantly, for patient safety, and at the end of the day as well, to protect your own license. So safety does take some hard work and some knowledge. From day one, I want you to ask yourself, why am I doing this for this patient? How is this supposed to help my patient? What are the complications with the medications that I'm giving or this procedure that we're doing or complications from the disease that the patient has? Is there a better way to do it? Do I understand the patho behind this disease? Do I understand how this medication works? You need to ask yourself these questions for every patient that you encounter. It will build your knowledge, especially while you are precepting, and over time, you're going to know more and more and get more confident. If you don't know something, look it up. You will not know something is safe until you have built a strong foundational knowledge. Once that happens, you'll be able to confidently ask yourself, is this safe for my patient? So, instances when you should ask yourself, is this safe for my patient? Anytime you or anyone is doing anything for your patient, you should be asking yourself that. Primarily, it'll be with procedures and medications. So, providers can get super busy as well, and they are human at the end of the day and can make mistakes and sometimes order on the wrong patient incorrectly. It's not your job as a nurse to decide which medication is going to be used. However, it is your job, your duty to ensure that it is a safe and appropriate for the patient. So let's give a little brief example on procedures. I had a patient once who was a dialysis patient and had cirrhosis at the same time and had a very distended abdomen. Came into the ER to get the belly tapped, and it was clear that's what the patient needed. They would feel better afterwards. However, many nurses, we tried getting access on the patient, we tried the EJs, and nothing worked. The provider still wanted to go on with the procedure of just a simple paracentesis without any access. But the nursing staff did not feel confident, and we kept getting pushback from the providers. Some of them said, no, it's a safe procedure, it's going to go fine, we don't need access. But, you can never guarantee with 100% accuracy that there isn't going to be a complication, bottom line, at the end of the day. So we ended up getting our attending involved and other providers involved, and eventually we ended up having the providers place access with via ultrasound. Thankfully, we did, because after the paracentesis, the patient's blood pressure tanked, and we ended up having to give albumin and a couple of other things. So at the end of the day, it just goes back to the first video, how I said to be proactive and not reactive. You know that there is no case where you can 100% guarantee that there isn't going to be complications. So if you stay proactive and not reactive and get your IV access, just in case anything happens, you stay proactive and stay safe for your patient and for your license at the same time. I just have to say this, but you always, always, always ask your patient what their allergies are. I've had instances where another nurse triages, and for whatever reason, they just list no allergies, but the patient has an allergy to penicillin or to contrast or to whatever. So you always, always want to ask your patient what their allergies are. You don't just want to go into a room, hang a med, start it, and then walk out. You have to talk to your patient, ask the allergies. Even if you already know them, ask them again, especially while you're precepting. In the ER, you go through so many patients, so you don't want to get one confused for another, especially in regards to the allergies. So always, always, always ask. So some medications to be extra careful with. You're gonna have blood thinners. Be extremely careful with blood thinners. Insulins, blood pressure meds, IV opioids, and especially pediatric meds. No matter the medication, always double check with another nurse. I use an app called Pedistat. It's a paid subscription. I think you pay like $5 or something like that. But I use it for any pediatric med that I'm giving on top of double checking with another nurse. Why do we do this? For patient safety. You want to take care of your patients, especially your pediatric patients. Blood thinners, simple things. Do you have baseline labs? What's their PT? What's their INR? What's their PTT? Are they going to surgery anytime soon? If they are, should you be giving a blood thinner? Are they bleeding anywhere? Are they bleeding from anywhere already? Is this the right dosing? For insulins, you need to check a blood sugar before administering any insulin to any patient. It should be ideally within the last 10 minutes. Do you know the peaks and the onsets of your medications? When are these insulins going to be taking effect? When do you expect the patient to have a reaction to it? Has the patient ever had insulin before? Is this too much of a dose for a patient who's never had insulin before? As far as your blood pressure meds, always check a BP before administering. Even if it's nitroglycerin, even if it's just a patch, I want you to check it beforehand. For IV opioids, is it a geriatric patient? Have they ever had opioids before? Or are they at least on pulse oximetry or a monitor able to quickly detect apnea? You can get super busy in the ER, and if they're not at least on a monitor, things could go really bad, going back to complications. And is there oxygen equipment readily available for your patients? And again, always double checks, especially with ped medications. So just a must do is if you don't know something, or if you feel unsure, ask your fellow nurses, or call your pharmacist for clarification. They went to school for that, so just know your pharmacist's phone number and call them for clarification. Lots of hospitals always have some type of approved app or website that you can use that will back you up if that website said it was okay to do. My facility uses Lexicom, and I primarily use this for medication compatibility. Did I spell that wrong? Let's see what's on. Final point, bottom line, always ask yourself, is this safe for my patient? Always ask yourself, is this safe for my patient? And from day one, I want you to ask yourself, why am I doing this? Is this supposed to help my patient? What are the complications? Is there a better way to do this? Do I understand the pathway behind the disease? Do I understand how this medication works? It's just going to help you build your knowledge. And over time, the more you know, the safer you'll be with yourself and with your patients. So as always, if you can, and if you're willing to go help support the channel through Epsi, you can check out our merchandise there. And most importantly, teamwork makes the dream work in the ER. Teamwork makes the dream work.